knowledge of this infection is very important. And with that, we have the agenda. What is encephalitis? How is it transmitted? What's the structure of the virus? How widespread is it? What risk do you have of contracting it? And what are the likely outcomes? So, yeah, as the name implies, encephalitis, we're thinking of encephal, cerebral or the brain, and then the itis means inflammation. So we're thinking of brain infection, brain inflammation. And CDC defines it as a leading cause of vaccine-preventable encephalitis in Asia and Western Pacific. It's also a potentially severe infection and has attendant symptoms. Right. Why is it called Japanese encephalitis virus? Because the first cases were described in Japan sometime in 1870s. And then, what are the related viruses? We're thinking because it belongs to the flavivirus family. So, like Johan initially said, arthropod-borne. So, related viruses are yellow fever, dengue, West Nile, St. Louis, and related, and all those viruses. And then how is it transmitted? The vector is the Culex species, and particularly the CDC mentions it as I can't remember how to say that, but it's a Culex species, and usually you have a bite of the mosquito to the host, that's the amplifying host, and then eventually it gets to humans. So we have three hosts here: the native host, the amplifying host, and then the dead end or incidental host. So when we say amplifying host, we're thinking of the pigs and wading birds. Why are they called amplifying hosts? Because usually the infection proliferates in them to very high levels, infectious levels. Unlike humans who are the dead end or incidental host, it doesn't get to so high levels like the amplifying host. That's the pigs and the wading birds. So, and that's the image or the illustration you have on your screen. I don't know, can you see the screen? Hello?
We're seeing well, yes.
Okay, great. I just want to make sure of that. And then about the structure, the virus owes its attribute to two proteins, the helicase and the polymerase. So I don't really want to go, I'm just giving you a background, so that's just a little bit about the virus. And then the distribution, if you see the places marked in orange, you see not only Japan, there are also other countries there. So you're thinking of Myanmar, Vietnam, India, Nepal, Malaysia, and then even recently, sometime in 1998, Northern Australia, they also had some events, in fact, 2 fatalities in Northern Australia. So even though you hear the word Japanese encephalitis, it's not only in Japan, other parts of Asia and Western Pacific too are also affected. And then, yeah, I got this from a paper from, it was published in CDC, and then you see that Japan is actually mentioned there, it's in asterisks. Usually in time periods from June to September, that's when you have the really high peak periods. And then in islands like in Okinawa, the Ryukyu's island, you have it sometime around April to October. And then other Asian countries, you have time periods where they're very frequent on this graph, which I'm sure Johan will share with you later if you're interested in having it. So now about the risk to travelers, what risk is it to you? It's actually quite low, but it varies individually with the season, with location, travel areas you're going to travel to, and then the duration, how long you're going to spend there. In the rainy season, it's usually higher in incidence because you have stagnant water, and then you have the mosquitoes tending to increase during that period of time. But it's interesting to note that in time periods when they have major floods or tsunamis, there's no evidence of increased transmission. Also, in the tropical areas, you also have it year-round, all through the year. While in temperate areas, usually in the warmer time periods is when you have epidemics occurring. And then endemicity has been reported in about 24 countries Southeast Asian countries, East Asian countries, and Western Pacific regions, and about 3 billion people are at risk. Now, even though the risk is relatively small, it's still important because the outcomes are really bad. If you look at this table on your screen, if you look at it, you see that only 4 reports of recovery were mentioned here. And even with recovery, sometimes 30 to 50% of survivors have significant neurologic sequelae, and 20 to 30% of these cases are fatal. So even though it has a very negligible incidence or risk, the effects thereafter are really huge. And that's why knowledge of this is really important. Right. So with about 3 billion people being at risk, we can understand the need for knowledge on Japanese encephalitis virus infection and the vaccine. Right. So rounding up, what is encephalitis? We understand it's an infection of the brain, has been transmitted by Culex species mosquitoes, was responsible for the virus transmission. You have the helicase and polymerase viruses. How widespread is it? Southeast Asian countries, East Asian countries, Western Pacific. What risk do I have of contracting it? It's quite negligible, but in terms of the outcomes, it's quite a high risk. And usually in terms of rainy seasons and warmer time periods. What are likely outcomes? Significant neurological sequelae and fatal outcomes too. So that's an overview of the infection. Thank you.
Thank you so much, Ruth, for a very nice introduction. And I must say that you're such a wonderful presenter to listen to. Now I'm going to introduce Kubonozo Sensei.
Yes.
Dr. Takaaki Kubonozo is a medical doctor and PhD from Kagoshima City, Japan. So we also did our PhD at the same institution. So Ruth and Kubonozo Sensei and myself, we graduated from the same postgraduate medical school. Dr. Kubonozo received his medical education from Kagoshima University Faculty of Medicine, and he also studied at the Max Planck Institute for Brain Research in Frankfurt, in Germany. He graduated from Kagoshima University Graduate School with his PhD later on, and was subsequently the chief at the Department of Medicine at Saiseikai Kagoshima Hospital. Now, Kagoshima is all the way down south of Kagoshima. It's right in that little crevice at the bottom of Japan. Kubonozo Sensei and I are both members of the International Society for Travel Medicine. And if you go to that website, you will see the Saiseikai Kagoshima Hospital listed there. So if you're traveling and you're in Japan, if you sign up in this network as a medical doctor or as a traveler, then you can be directed to either Saiseikai Hospital or similar center in Japan that's within this network. And in Jamaica, for us, Caribe Wellness is a part of this International Society for Travel Medicine. So I'm going to turn over now to Kubonozo Sensei.
Yes.
Thank you, Kubonozo Sensei. Thanks for joining us.
Yes. And can you hear me?
Yes.
And can you see my PowerPoint slide? Well?
Yes, we can.
Okay, all of the portion is in your screen?
Yes, we can see everything.
So, shall we begin? Okay.
Yes, please go ahead.
Yeah. So, thank you for your kind introduction of me, Dr. White. And I'm greatly appreciate attending this exciting conference. And I also thank Andrew Henry for his great help for today's presentation. Now, my theme given by Dr. White is it necessary for travelers to Japan to get the JE vaccine? Dr. White?
Yes, we can hear you.
Can you hear me? Well?
Yes.
Okay. First of all, I'd like to ask you all the next question. Is Japanese encephalitis a Japanese disease? In the 1950s, approximately 5,000 cases a year, about 20% fatal, were reported in Japan. However, recently only fewer than 10 cases. On the contrary, there are a great number of Japanese encephalitis patients in Asian countries. So why such name was given? It is because Japanese encephalitis virus is firstly derived from a Japanese patient of acute encephalitis in 1935. It's a reason why named Japanese encephalitis. Okay. Now, today, I review CDC's recommendation concerning the JE vaccine and then present more detailed explanation as a physician working in Japan based on Japanese data. This is from CDC, the home pages. CDC recommend JE vaccine for travelers who plan to spend 1 month or more in endemic areas during the JE virus transmission season, and short time, less than 1 month, travel to endemic areas during the transmission season if they plan to travel outside an urban area. Travel to an area with an ongoing JE outbreak. Of course, so travel to endemic areas who are uncertain of specific destinations, activities, or duration of travel. And CDC not recommends for short-term travelers whose visits will be restricted to urban areas or times outside the well-defined JE virus transmission season. Which risk is there? Very reasonable recommendation, but if we read it again, some questions are preparing. Japan is endemic? Find the transmission reason. Then I will answer these questions. Slide 8. CDC health information for international travel, it's commonly called the Yellow Book, shows wide areas from Southeast Asia, Central Asia to West Asia, including Japan, are risky for Japanese encephalitis. But in this map, we can know the degree of the risk. So I see you a map from a Japanese textbook. This shows the number of JE patients of each country. Japan, 150 per 15 years. China, 222,000 per 5 years. India, 42,000 per 5 years. So incidence of JE in Japan is very low compared with other Asian countries. And more, this figure shows the exact number of JE patients reported in Japan. In 1966, about 2,000 patients In 1967, JE vaccine was strongly recommended by the Ministry of Health and Welfare of Japanese government, and in few years, number of patients are fairly decreased, like this. Moreover, in 1989, this year, new vaccine which produce wide spectrum antibody effectively were developed. So since 1992, incidence has been extremely low, less than 10 every year. Then, is there low risk of JE infection? Remember that JE virus is transmitted with mosquitoes, which bit JE infected swines. When the mosquitoes bite another swine, JE virus will be transmitted to the bitten swine, and virus is amplified in the body of swines. The infected mosquitoes could also bite humans. Then some of the bitten humans appear JE symptoms. After infection, human swine make antibody to the JE virus. So if antibody titer against JE virus increases, the host is supposed to be infected. 13. This figure shows positive ratio of JE antibody of swine in the year of 2000 to 2013. You can recognize fairly high rate, the yellow, so high ratio. You can recognize fairly high ratio of JE antibody in west and southern part of Japan. Also in central area, Kanto, Tokai, Hokuriku district. Moreover, surprisingly, Akita prefecture of 2008 is drawn with red. Sorry, 2005 is drawn with red. Red is over 50%. This data indicates prevalence of JE antibody in swine, which suggests JE virus infection usually occurs, at least among swines. Now, so we encounter paradoxical findings. Reported JE patients extremely low in Japan. It's paradoxical. Prevalence of antibody against JE virus in swine still high. To explain this paradox, I will introduce an excellent article of Dr. Matsunaga et al. Dr. Matsunaga owns a clinic of pediatrics and international medicine located in an urban area of eastern Tokyo. This is the article. In the letters to the editor of the Pediatric Infectious Disease Journal of year 2008, Dr. Matsunaga et al. Measured titer of non-structural protein 1 antibody, NS1 antibody, which increase only with natural JE viral infection, and titers of the HA antibody, which increase with both vaccination and natural JE viral infection. HA antibody increased with both vaccination and natural JE viral infection. Blood samples were obtained from 15 volunteers and patients for 2 to 3 years from each subject. In this figure, black bar indicates change in NS1 antibody. NS1 increase when infected natural virus in each serum series, and the gray bars show changes in HI antibody concentration. The adjacent bars, 2 bars, are results for a single person. The NS1 titers, black bar. But the NS1 titers indicate that the incidence of JE viral infection has increased with subject age, whereas HI gray titers have slowly fallen with subject age. Authors also find out that 2 of 50 subjects showed rapid and marked increase in NS1 titer. One showed no symptoms, and another had a low-grade fever. These results suggest that human JE viral infection remains prevalent in Japan, although symptoms can be mild or absent. Now, we understand the prevalence of JE virus also in urban area. We also have a report that 3 American servicemen suffered Japanese encephalitis in Okinawa in 1991. Marine serviceman. Now the patient had administered J vaccine. Summary for now. Incidence of JE patient is low in Japan. However, human JE viral infection remains prevalent. Vaccination against JE remains extremely important. As additional discussion, where is endemic area? Patients have been reported in West Japan, South Japan, and middle part of Japan. There are no reports in Tohoku and Hokkaido. But as I told you, in a prefecture in Tohoku, in one prefecture in Tohoku, high titer of J antibody was recognized. Okay. Akita prefecture. So only Hokkaido is not the endemic area, and this slide shows positive ratio of J antibody in July to October of year 2008 with a passage of time shown every 10 days. January the 1st, 11th to 20th, August, same. And since beginning of July, antibody against J increased slowly, go to red till October. The period including these days is thought to be transmission season. We are now reached the conclusion and take-home message. Travelers who plan to spend 1 month or more in all areas of Japan, including urban cities, including Tokyo, including Osaka, except for Hokkaido, during at least June, is before beginning of rainy season, to October, should get the J vaccine. It's all my presentation. Thank you very much for your kind attention. Thank you.
Okay, thank you, Sensei, and thanks to both of our presenters for very detailed and very informative presentations, and which were very clear as well and readily understood. It's interesting, before I invite questions from other participants, one of the things that we know about the JE virus is that one person with JE virus will infect 1.2 other persons. So we call this the reproductive number of the JE virus. So why I'm mentioning this is that for a reproductive number of 1.2, usually to stop transmission in your population, you need to vaccinate more than 80% or 85% of the population. So this suggests that in Japan, most people receive the JE vaccine.
Yes.
At what age do people in Japan get the JE vaccine usually?
Sorry.
I imagine that it's included in the childhood schedule of vaccines.
Yes. Almost all Japanese take J vaccine 4 times. But sorry, I can tell you the exact age. Sorry.
That's fine, but they receive about 4 shots. Do they have to get a booster shot at some point, or
Yeah.
usually just 1 point in their lives?
The last shot, the fourth shot, is a booster, and after then, usually no booster.
Okay, I see. Thank you for that.
Can I say something?
Yes, go ahead, Ruth, please.
So, for example, because I have the mother's handbook here with me, so my son was actually a recipient of the JEB vaccine.
Yes.
So from 4 years onward, they give them that. And usually they give them 2 shots and then a booster.
Okay, I see.
Yeah.
I see. Yes, because I remember your little baby boy, and he was born and grew up in Kagoshima.
Yeah.
And you know, as you said, you have the mother's handbook, and you know, that offers such an important insight. So I'm glad that you were able to share that that with us. Kubozono Sensei, have you
Yes.
seen foreigners at your clinic who have asked for the JE vaccine?
So, sorry?
Have
So,
you had foreigners at your
for,
travel health clinic who get the
yes,
JE vaccine?
yes. Uh, uh, four foreigner per 3 year uh,
Oh, okay.
came to our hospital because J vaccine uh, of in Japan is cheap, not expensive.
Okay.
It's a
Okay.
reason they said.
Okay. I see. And one of the important things that you said in your presentation is is that the transmission is low in Japan, but in other parts of Asia, such as China and Korea and Indonesia, transmission remains high in these areas. So persons who are traveling to Asia, not just Japan, even though it's called the Japanese encephalitis virus, it's really an Asia encephalitis virus. So
Yes, yes,
Japan has a very developed public health system, and unlike other parts of Asia, in the poorer countries or regions of Asia, public health systems are less developed, and so vaccination may not be as wide, and so you could have more ongoing transmission taking place, and sometimes persons don't think about this risk factor when traveling to these areas. So you mentioned a very important point that it's not just a Japan virus, but it affects all of Asia.
Can I ask a question?
One of the things, yes, please go ahead.
Yes. This is directed to Kubuzuno Sensei. Are there any
yes.
side effects or adverse reactions to the vaccine?
J vaccine.
Yes.
We will i- uh, the J vaccine named JVIC V. You know, uh, I uh, haven't experienced any side effect,
Mhm.
Okay.
but severe side effect uh, would be happen. Severe side effect would be happen. Uh, maybe one times per uh, 100,000 to million shot, I suppose.
Okay,
Okay.
okay. You know, Andre, that was a question that I had on my list here. So that was a very good question. Um, do you have any uh, final comments, or first of all, from our other participants, do you have any questions about the JE vaccine? I see that we have 12 participants here. I'm very pleased to have um, you all here. Does anybody have any question about the JE vaccine? I think with the JE vaccine, it gives us hope that for so many emerging or new viruses that we've been observing, like CHIKV or chikungunya virus or
Or yeah.
Zika virus, which do not yet have vaccines, that there is in fact hope of having vaccines for these conditions. these conditions spread very rapidly. When Jamaica had the chickpea outbreak, the entire island, everybody basically, and some people would say even their pets, cats and dogs had chickpea.
And
Um,
sequelae.
and the complications afterwards.
Yes.
In the case of chickpea, persons complained for months about joint pains, and as you've heard with the JE virus, the sequelae or the complications are even more severe.
And just to
So
interject,
causing.
persons have
Mhm.
actually, there have been cases of death in terms of complications that occur due to the chikungunya virus.
Mhm.
I can speak
That
personally for someone who died.
okay. So the deaths are rare with chickpea and also with ZICV, the other one that's going on now. But in the case of JE, if complications do develop, they are quite severe in the case of the Japanese encephalitis. Um, One of the things I noticed from Kubozono Sensei's slides is that the warmer areas of Japan, which makes sense, is where you have most of the transmission of JE. So Okinawa, which is all the way down south, um, in that little box to the right-hand corner, that little island is actually Okinawa, and Kagoshima is to the left of that in the graph, but on the actual geographical landscape, Kagoshima is north, way north of Okinawa. So those are the warmer areas of Japan, and that's where you have, well, mosquitoes do not like the cold, and that's where you have most of the mosquito activities going on. Ruth, do you have any comments?
I just wanted to go a little bit into what you said. The number needed to treat. There was something you said about 1.2.
The reproductive number.
Exactly. We actually call it in our systematic reviews, we call it the number needed to treat. And then if you apply it here, it's the number needed to vaccinate.
Mm-hmm.
So, like, this produces what you call the herd immunity, which I'm sure we're familiar with. So the more
Right.
people who go through, who take the vaccine, the less the incidence in the population.
Yes,
Right.
absolutely.
So, yeah, so
Absolutely.
that's the idea. So even though one may be thinking in terms of personal benefits from taking the vaccine, it also helps generally the population by virtue of whatever other habit it calls. So that's just what I wanted to say. And one more thing, it's very interesting to know that during tsunami periods or floods, it's not so, the incidence is not as high as expected. Probably because the water is flowing, it doesn't stay stagnant.
Mm-hmm.
Yeah, and then the issue of colder periods, it doesn't really have a high incidence too, is also very interesting, and that may give us insight into all these other upcoming viruses, which I'm
Okay.
sure we may cover in subsequent health talks probably.
Yes. Thank you, Ruth. One of our participants is asking, could you just repeat when it's recommended to get the vaccine? So, Kubozono Sensei,
Yes.
when should travelers get the vaccine? At what times is it important?
Oh, uh, if the traveler have got vaccine before when uh, infant, no, only one shot is recommended, and before 2 weeks before the departure
Okay.
uh, were earlier, but never get J vaccine uh, in infantile. So 2 shot is necessary. 1 shot and 7 to 28 days after the first shot, and then it, it is better. It's before 2 weeks before the departure. Sorry, you know.
Yes.
Okay.
That was very clear, actually. Thank you, Kubozono Sensei. One of the things I'd also like to point out is that over the years, we've had better JE vaccines. So the earlier vaccines had a lot of complications because those older vaccines used to be produced in mouse brains. And so that had complications when they were given to humans, sometimes causing disease in humans. But those vaccines are no longer being used, and we have much safer JE vaccines. One of the major companies is Sanofi, which produces a good JE vaccine. And I'm sure there's also a Japanese company that does that as well. But the more recent JE vaccines are much safer. They are not produced in mice. They are produced in a laboratory in cell lines in a much cleaner environment, and where the activity of the vaccine can be predicted more accurately. So some persons may search on the internet about JE vaccine, and they may come up on the stories from the older vaccines, which had many problems, but now the vaccines are much safer. Kubozono Sensei, the
Yes.
vaccines that you use are manufactured in Japan?
Yes.
Okay.
It's called JVIC.
Uh,
It is produced by Beacon
okay. Okay.
Pharmaceutics.
Okay. Okay.
And
Wonderful.
I don't know any other vaccine, but in the world, some Xero
Ixero.
or
Yes.
it's famous for all over the world.
Yes.
And how about Xero? Is it convenient to use, or any other opinion?
Ixero is the vaccine that I know, actually. And I believe, if I recall correctly, that's the one that's made by Sanofi.
Sanofi.
Interestingly, we do not have the JE vaccine in Jamaica, and so it's not widely available, and so persons traveling would need to consult their travel health physician well in advance, so that arrangements can be made either for it to be shipped, or to make an arrangement with a clinic in or near the destination where they can receive the vaccine. So it's really important to see your travel health physician well in advance of your travels. Um, as you will recall from what Kubonozo Sensei says, that it requires 2 weeks for you to develop a protective antibody response. So 2 weeks before departing, and we always during the World Cup in Brazil some years ago, when we were advising persons about the yellow fever vaccine, we had to keep reminding travelers that you can't get the yellow fever vaccine the day before departure, because there's no time for you to develop a response. You need it at least 10 days before departing. So similarly, the JE vaccine is required about 2 weeks before flying. If you get it the day before, then the day before you travel, then you will still be prone to getting the vaccine because your body has not yet developed antibodies. Okay. So, are there any other questions before we close? If not,
I asked a question, and Mr. Maxwell has a question that he'd like to ask.
Yes, go ahead.
Okay. Good morning, everyone.
Good morning.
Looking from a long-term perspective, though the virus is low in humans, and we're encouraged to take the vaccine, what preventive measures are in place to reduce the prevalence among swine? I have read that their deaths have an economic impact somewhat, and based on the life cycle I've seen in the presentation, they are the primary reservoirs for the virus. So I'm looking to see I wanted to ask what is it that is being done to reduce the prevalence among them, and that would also eventually reduce the transmission.
To our presenters, do you know of any initiatives in dealing with the pigs? Are there? I don't know if there are veterinary vaccines to protect pigs, or there are any other initiatives to limit transmission among the pig population? Kubonozo Sensei?
Yes.
Are there any activities being done to limit or to reduce transmission among swine? Are there any
Vaccine for swine?
Yes, are there any activities like that to limit transmission among swines?
Sorry, but I don't know.
Okay, right.
Sorry.
It's a difficult question.
I think it's an interesting question.
Can I say something?
I think it's an interesting.
Is that Ruth?
Yes, that's Ruth.
Yeah, that's me.
Yes, go ahead.
Okay, so actually, because it's the idea was to try and limit it in humans, and the idea was that eventually it was going to have an effect on the pigs. So I just looked through it now. I said they actually vaccinated pigs sometime between 1960 to 1985. But then they didn't have they didn't really see any effect, so to speak.
Okay, I see.
And then another study showed that the pig vaccination was only to prevent abortion and miscarriage in breeding swine.
Oh, okay.
That was what it was for. Yeah, so it wasn't really so effective. I mean, the major concentration was on human vaccination, not animal vaccination, actually. And then when it was done, it was only for a limited period of time in Japan. But one could actually look it up. Actually, it should be in all these veterinary journals. You could find some information on that actually.
Right.
Can pregnant women get the vaccine?
Right. So for Ixero, what we know is that I'm looking at the insert here. It says um, reproduction studies have been performed in female rats with up to 300-fold higher doses of the vaccine, and there has been no evidence of an impact on fertility or harm to the fetus in these rats. So that is the um, statement that I'm seeing here. So no adverse effects on
The rats.
mating, fertility, pregnancy, parturition, or lactation. And they also say here that it is not known whether Ixero is excreted in the human breast milk. So as with any other medication, one would exercise caution and weigh the risk of receiving the vaccine versus exposure to the actual virus. So in that case, if one could discourage a pregnant traveler from going during pregnancy, that would be ideal. But if there is an emergent situation, then one would have to weigh the risks of being exposed to the virus at the destination. If they're going to be locked up in a hotel, in air conditioning, away from mosquitoes and so on, as opposed to going out into a rural rice farming community, then the risks are different. Also, if they're going to be staying during times of the year outside of the rainy season, then the risk may be lower. Also, if they're going to be staying for a short period, like 2 or 3 days, as opposed to a month or 2 months, then one would have to weigh those risks.
Okay.
Okay. All right. So with that, let me thank our presenters, Dr. Ruth Chibueze and Dr. Takaaki Kubonozo, for two very informative and enlightening presentations, and I'm sure that our participants today have obtained valuable information that they'll consider. I mean, traveling is now a lot easier with, a higher number of flights going into Asia, and people are traveling not just to Japan, but to China and Korea and Indonesia. And the risks in these different regions vary. And now people will understand that there is another life-threatening condition out there, also spread by mosquitoes. But unlike many of the other mosquito-borne conditions, there is an effective and safe vaccine that's available. And now our participants can pass the word on, and they can be more informed, and they can ask, about what their risk is and how they can access these preventive or protective measures. So once again, Kubozono Sensei, arigatou
Yes,
gozaimasu. And
yes, and I have
Ruth,
studied many things from in this conference. Thank you, Dr. White.
okay, thank you so much, and we look forward to being in touch with you, either through the International Society of Travel Medicine or
Me too.
during a visit to Japan. And Dr. Ruth Chibueze, your presentation was very clear, very informative, and we look forward to hearing you again in future presentations. And again to Andre Henry for helping to make this possible, and to our guests for attending. Thank you so much, and have a good day and a good night in Japan. Thank you.
Thank you.
Thank you.
Thank you.